The CDC confirming the worst about the fentanyl crisis here in Oregon.
And this is sad and troubling. Oregon had the largest year-to-year increase of fentanyl deaths in the nation, with the state of Washington close behind. Brandon Thompson here now digging into this report. And Brandon, you're finding out really just how bad this is for Oregon.
Yeah, the number of people who are dying from fentanyl is staggering in Oregon. There are more than 1,200 people to end the year of September 2023. That is 500 people more than the last year. That is an 80% increase from 2022. 4 years ago, the stark difference is even more clear. 78 people in 2019, 1,200 last year. That's an increase of 1,500%. The latest numbers from the Centers for Disease Control and Prevention show Oregon as one of the states where the fentanyl crisis is hitting hard. The state experienced the largest percentage increase in drug overdoses from September 2022 through September 2023. Washington just slightly behind. The overdoses, the data show, is powered by fentanyl. 13% of overdose deaths 4 years ago were related to fentanyl. Last year, it was 72%.
It confirms, I think, what we're seeing just anecdotally around our districts and around the state, that we have an opioid crisis.
One reason the Health Justice Recovery Alliance says fentanyl came to the Pacific Northwest later than the rest of the nation and just as the pandemic began. The state, City of Portland, and Multnomah County have all declared an emergency to address the crisis. In the nearly 3 weeks since the declaration, goals or actions have not been made clear. In Salem, state lawmakers are also trying to fix Measure 110, the voter-approved measure that decriminalized the possession of small amounts of drugs.
We recriminalizing it with compassionate off-ramps gives family members, loved ones, as well as law enforcement the tools they need to hopefully, reduce the number of fentanyl overdose and drug overdoses.
HJRA backs Measure 110 and says the state has failed to timely establish treatment and, quote, this increase should be a call to action for state leaders to finally expand access to the treatment and addiction recovery services Oregonians have literally been dying for, instead of wasting taxpayer dollars on expanding criminal penalties that the Oregon Chief Justice says can't be implemented with current staffing.
While we may disagree on the best way to get people into these programs, what we all agree on is that we don't have enough.
So Oregon's per capita death rate is behind 16 other states of 34 states that contributed data to the CDC. But in the past 4 years, that per capita rate has nearly quadrupled in Oregon. Now, Salem lawmakers are taking this up. There are 3 different bills that are really being considered, all of them with varying degrees of different criminal penalties.
Of course,
or misdemeanor, that is.
This should continue to push the urgency of trying to find solutions that will work for this dire issue.
Democratic leaders saying today inaction is not an option.
Yeah, absolutely. Brandon.